So to actually document, when you're giving a drug to a patient, it is assumed that the patient has a condition that requires treatment for you to be giving a medication to the patient. So to do that, let's see how you can do it. First of all, you log into your professional account, and once you put your professional ID and password as we discussed in previous video, you will see that the institutional gateway where you have been enrolled will automatically be filled in the institution ID. Then you go ahead and log in. So when you log into your folder as a healthcare professional, and we assume that you already have a folder for the patient, so you go ahead and click attend to patient. So if you want to use the patient ID option, click on get started. You key in the patient ID. So in this case, PAT 01661. So selected, you log into the patient folder. So when you log into the patient folder to start documentation, and I mean every kind of documentation you want to make in the patient folder or for a patient, it starts with clicking on create new record. So when you click on create new record, you have clinical clerking tool, you have requisition tool, which is for lab tests and other investigation in healthcare. You have the prescription tool for you to write a prescription. You have referral tool, you have pharmaceutical care tool, and there are other services that you can also capture here. There is equally delivery documentation where applicable, and it's only shown in women folder. And then there's antenatal and postnatal care, there is vaccination tool, there is family planning, there is pharmacovigilance and appointment tool. So let's go ahead and record diagnosis. How do we do that? For you to assess diagnosis, not just diagnosis, but anything that has to do with capturing what is the problem of that patient, keeping detailed history or documentation of the patient condition, you use clinical clerking to do that. So when you click on clinical clerking, system will load the tools on clinical clerking for you, which start with patient complaint and so many other fields that you can document with. But now I'm trying to show us how to capture diagnosis. So you click on diagnosis, and then you can see the field for you to enter diagnosis. How do you use this tool? You click add diagnosis. Look carefully. Then you click on this diagnosis, and the system will drop down this field for you. Go ahead and type the diagnosis. Let's say it's diabetes. You want to type. You can see. So you can see all types of diabetes: diabetes mellitus, diabetes, insulin dependent diabetes mellitus, which you know is different. So this is the one that can respond to oral medication. There are many types of diabetes you have here. So depending on the type of diabetes that you are managing, so this will help us to actually narrow down our diagnosis to a specific condition. Instead of saying diabetes have different kinds. It can be insulin dependent diabetes, insulin dependent diabetes mellitus with comma, insulin dependent diabetes mellitus with ketoacidosis. So let's assume we're managing diabetes mellitus. There's no complication in this case. So we have selected that, and then we select is a chronic case. So we click add. So it's not a new patient. The patient is just coming for possibly to fill their prescription. So click add diagnosis. You can see we have added that. So let's assume we also want to add, let's say, hypertension. So you click on this field again. So you enter hypertension. Alright, you can see hypertensive disease, essential or primary hypertension, which is what we know. So is essential hypertension. We know what we mean by essential hypertension. So that is basically the primary type of hypertension. So we select it here. Then If it's a new case, you say it's a new case. If it's a chronic case, you select is a chronic case. It's not a new patient, it's just a returning patient for one reason or the other. So you add it here. We are trying to identify all the conditions we are managing or that need to be managed in the patient, whether with medication or non-drug therapy. So this is how to capture the diagnosis on this tool. And you can see you need to define the status of that diagnosis. So let me add more and put something that may not be chronic. So let me select another one. I click on it and it drops down for me. In this case, I want to say, let me say typhoid. All right, so typhoid fever, right? Selected. So in this case, I can say recurrent case. I add, and then I can see define another diagnosis. This time around, let me say is let's say it's a ulcer, peptic ulcer, right? Let's call it peptic ulcer. Let's see what will come up. Can you see peptic ulcer, right? Ordinary, just site unspecified. Okay, we select it. What is the nature of the diagnosis? Let's say suspected case. We're not just as we're not sure. So this is how it goes. So can you see that we have actually added quite a number of diagnoses on this tool? So this is how to use the diagnosis tool, and with this you can actually begin to group your patient into different disease categories. So this person, for instance, will appear in the diabetes group, it will appear in essential primary hypertension, it will appear in typhoid fever group, it will appear in peptic ulcer site unspecified group. So this is how to actually use the diagnosis tool, and I recommend that we all use this diagnosis tool because this will help us to understand what kind of cases do we manage in our pharmacy, so that with this we can actually convince stakeholders on the need to collaborate with community pharmacy to deliver more value to the citizens.